Welcome back to Stanton MD. On January 30th, 2016, fire ripped through the Bluegrass Stockyard in Lexington. Hundreds of firefighters and other agencies battled one of the largest fires in Kentucky history. During the hours of the fire, 7 acres of stockyard and businesses burned. The firefighters that responded to the scene had the most up-to-date gear to help battle the flames and keep them safe. But that only lessens the risk that these men and women face on a daily basis. A few days after the fire, we went to the scene and talked to firefighters about the risks and tools that help keep them safe during the fire. But we also learned that some of those tools have risks of their own. I'm Dr. Ryan Stanton with Tools of the Trade. Once again, here in the middle of the Bluegrass Stockyard, a scene of utter destruction, cars burnt everywhere. And today we're going to look at some of the things that keep these men and women safe and some of the challenges they face when they face a large fire. With firefighting, heat is the most obvious threat, but there are other risk exposures as well.
You've got smoke inhalation, you got the gases that are given off from the fire, which CO, cyanide, or any other type of carcinogenic reaction to smoke. And so a lot of bodily exposures as well.
What do we do for these men and women when they come on these scenes to help protect them?
Well, we've got our protective gear that we wear that's supposed to stop most things, but as we're finding out as well, we're also absorbing these gases and carcinogens with the soot. And but we also have our pressurized tanks, which we breathe in pressurized air, and so it keeps us from inhaling through our lungs. And obviously our hoods and our entire bodies are covered with the proper gear to keep us safe as much as possible.
As technology advances, some risks may be abated, but others may increase.
Advancing technology-wise years beyond what it used to be 30 years ago, 10 years ago even, and we're able to go deeper into fires. And the good thing is we're able to put them out sooner, hopefully. But the bad thing is we're exposed to those immense heat and may put us in more danger of trying to get out.
Emergency workers aren't the only ones at risk. The public is also exposed to chemicals and threats to their health. If there is a fire nearby, what should you do to increase safety and decrease risk?
It's not a safe atmosphere, and it's not a safe area, and you need to move away into a safe area and away from the travel of the smoke.
For most of us, the adage says that we put our pants on one leg at a time, but in the fire service, proper attire is the difference between life and death. Now we're arriving to the scene. Huge fire, 7 to 8 acres, cars involved, power lines involved, all heck's breaking loose. First challenge is going to be the heat. How do we deal with the heat?
Well, prior to that, any run that we get that involving fire, we automatically put all our gear on. It's going to consist of the jacket, which has the outer liner, and you've got an inner water liner also to protect. This is Kevlar. You've got your boots. You've got your Nomex hood also to put on. We've got our boots, and the pants are the same way, lined outside in that. Also too, we've got it mounted inside our truck. We've got an SCBA. That's actually going to help us with the superheated airs breathing in, not only the smoke, just the fact without destroying our lungs. So we're going to fast forward, and Firefighter Brown is magically dressed in all his gear. As you can see, he's got his gloves, flashlight, we've got our hood, got everything in here tight.
So how much are we talking about in terms of we're going into a fire, house fire, a fire like this? How much weight are we talking about that we're lugging through all the scenes?
60 pounds with just about the gear on here. When we start carrying extra tools, we're looking at up to over 100 pounds that we're carrying extra on top of us.
Protective clothing is just the tip of the iceberg for risk facing the firefighters. Next week we will talk about some of the other challenges and tools the firefighters use to stay safe. Every day, men and women across this country stand ready to fight fires like this one. They may not be as large as the Bluegrass Stockyard fire, but nonetheless the challenges are there and they stand ready for our time of need. I'm Dr. Ryan Stanton, and this has been a Tools of the Trade. The world has two types of people, those that run from danger and those that run towards it in hopes of helping others. Our hats are off to all the first responders that risk their lives to help keep us safe. On top of the risks that we discussed in this segment, firefighters also have a research-proven higher than baseline cancer risk. Firefighters are currently not covered for occupational-related cancers here in Kentucky. A bill is currently in the legislature that will hopefully address that. More information is available about the Lexington Fire Department at lexingtonky.gov under the Division of Fire and Emergency Services tab. Once again, we thank all the first responders out there for your service. I'm here with firefighter Gert. We're going to talk about hands-only CPR. It's, over time we've heard about everybody needs to know CPR, and it is the one thing that you can do to help save a life. It's going to take several minutes for the ambulances to get there, several minutes from there to even get to the emergency room. So the likelihood of somebody surviving is going to be dependent if somebody goes down, starting CPR, knowing what to do in order to wait for those guys to get there so they can continue from there. So firefighter Gert, thank you for joining me.
Thank you for having us.
Okay, so we're coming upon a scene. Somebody collapses down. What are the first things you're going to do?
First thing we want to do is make sure the scene is safe. We're not sure how this person has ended up in the position they are. Once the scene is safe, then if they are unresponsive, we want to start hands-only CPR. It's a big push with hands-only CPR.
Now, how is that different than the traditional CPR that we've seen?
The traditional CPR is you would do the compressions and then you would follow it with the mouth-to-mouth portion of it. And we understand that a lot of people just don't want to do the mouth-to-mouth portion of it.
The creep factor there with putting your mouth on somebody's mouth. And what we found with the research is that for the first 5 minutes of CPR, the circulation of air and the perfusion of the brain and the vital organs is equivalent with hands-only CPR as with hands-only CPR and with the breathing. So you're not shortchanging somebody. In fact, you're increasing their likelihood of survival, one, because you're doing the procedure, but two, also you're continuing that blood flow and oxygen circulation through the brain and vital organs. So how do people do hands-only CPR?
It's a real simple process. Like you said, if you're moving blood, you're moving oxygen. We want to push hard and fast. You want the lower breastbone of the chest. You want to lock your hands if you want to push hard and fast. 100. You want to do 100 per minute, 2 inches deep.
So with 100 beats per minute, how is somebody going to know 100 beats per minute? Because what we find is that when people try 100 beats per minute in a stressful situation, it turns up being 200 beats a minute. Or they overkill on the other side and they go 40 beats a minute. How are people going to think about 100 beats per minute?
One of the things that we like to use when we educate the public is the staying alive beat. It's any song.
So the old disco tune.
The old disco tune. Anything that's got 100 beats per minute. That's a good way of assisting you when you're doing your compressions.
So what you can find is that you can look up or you can download Staying Alive as the tune that's actually available there, or you can look up any other song that's 100 beats per minute. In fact, I've Googled it in the past, and there's several songs they have listed. So if you're not a disco fan, you can find whatever song you want that can help out. The key here is to practice to make sure you know how to do it. We don't want to have anything other than the palm of the hand pushing onto the chest. You want to make sure that you're pushing hard enough. That's key. We got to get that compression of the heart as well. All right, firefighter Gert, thank you very much. I appreciate your time.
Thank you, Doc.
Stay safe out there. This has been some tools of the trade right here, learning some hands-only CPR.
Hi, I'm firefighter Kyle Brandon with the Lexington Fire Department. If you would like more information or would like to have a class or us to come out to your business, just call me at 859-231-5618 and we'll set up a hands-only event for you or your business.
Each month we'll take some time to give you 5 or so tips for better, healthier living. This month we have 5 things you can do to be prepared for emergencies and major illnesses. It's a simple fact that none of us are planning for an emergency, but there are steps you can take to help prepare for the unexpected. First, get some ICE. This stands for in case of emergency and is the key data that emergency workers need if you're unable to communicate. Smartphones provide the perfect solution, allowing this data to be added to the home screen or emergency contacts of your phone. Next, you want to establish advanced directives. This is the document establishing your wishes for your care if you become unable to speak for yourself. This includes code status, resuscitation, and who can help make medical decisions. Once this is in place, inform your family, those that will make decisions and need to know your wishes. You'll also need to let them know any important information and where important documents are kept in the home. To do this, you need some organization. Keep your paperwork in one location where it can be found. Family or loved ones need to know where this is, and it needs to be labeled for quick and easy reference. Finally, you need to get a primary care doctor and at least see them once a year. A good primary doctor can help guide you through the stages of health and, more importantly, can provide preventive care. So take some time to establish these 5 steps so that you're well prepared in case of emergency. That's a wrap for episode 1 of Stanton MD. I'm your host, Dr. Ryan Stanton, and I hope you will join me the first Saturday of every month at 7 a.m. as we bring you the tools and information that will help keep you healthy and safe. If you want more information about the show, you can check us out at StantonMD.com. That's StantonMD.com. Also invite your comments and suggestions about the show to Ryan at StantonMD.com. Until next month, I'm Dr. Ryan Stanton. Stay safe, stay healthy, stay informed with Stanton MD.